Hello everyone, welcome to BetterBirth360. Today I'll be interviewing Connie Livingston, who has over 35 years in the field as a nurse, childbirth educator, doula, and is also an author who brings evidence-based best practice information to both parents and professionals in a variety of settings, from workshops to conference sessions to social media. She is also the president of International Childbirth Education Association, or also known as ICEA, which is one of the oldest certifying organizations and is celebrating its 55th anniversary this year in Las Vegas. ICEA trains and certifies birth doulas, postpartum doulas, childbirth educators, prenatal fitness educators, and has certificate courses in lactation and mother-friendly labor support skills for nurses. As a military wife, Connie and ICEA have created the Military Mothers Initiative, which brings more access to support and education to military members and spouses in a variety of ways. Today, Connie will be talking about the impact of education and informed consent on the success of physiologic birth and positive pregnancy outcomes. Before we start a conversation about that, Connie, can you tell the viewers a little bit more about yourself and what inspired you to become a doula, childbirth educator, and an advocate for a normal physiologic birth?
Well, I think for many people in our profession, it had to deal with a birth experience that they had personally, and that's not any different for me. My first birth was traumatic, to say the least. I won't go into details, but there were some things I could have done differently had I been more aware of my options. I did go to childbirth class, but as a nurse, I still held the philosophy that the physician knew everything that was right about this labor and birth. And I also was in a hospital setting, which sometimes can give people the impression that pregnancy is a condition of illness, which it's not. It's actually a condition of health. And so during this time of being in labor and then ultimately having a forceps delivery, I decided that there needed to be some sort of a change in the way that I practiced, a change in my whole philosophy in regards to childbirth. So what happened is I contacted my childbirth educator after the birth of our first daughter and decided to funnel my frustrations and my energy into becoming a childbirth educator, which I did. And I've been doing it ever since for 35 years. I became a doula in the late 80s, mainly because a lot of the clients that I was seeing in my childbirth class were also military couples. And many times the person who was in the military was out on maneuvers and couldn't be at the birth of their child. So they needed someone to support them. And since I was one person that they knew they could trust, then I was asked to come to a variety of births, and everything just kind of fell into place after that.
Very cool. So Connie, can you share your insights on the importance of education and how making a fully informed consent is important for promoting a normal physiologic birth?
Well, I'd like to go back to the ICEA tagline, which is freedom to make decisions based on the knowledge of alternatives. And as the author Diana Court said one time, if you don't know you have any options, then you really don't have any. And today, with fewer and fewer women attending childbirth classes because their schedule may be full, or they work later and there is no childbirth class in the time that they have, they don't get the information about what choices they do have. Or maybe they had thought about hiring a doula, but never did. And so the doula education piece, doulas are very in the forefront of educating parents because they often see parents before the childbirth educator does. then the doula can help to educate the expectant parents as well. So we see a deficit of information. We see an inability of the parent to make these informed decisions because they just don't have the information. They may watch TV, they may watch a variety of different childbirth education shows on TV. Well, I don't even want to call them childbirth education shows, but there are a number of shows that do show births. And so parents feel that when they are looking at these shows, this is the real thing. What they forget is that this is a television show that makes its money off of the sensationalism surrounding the birth. So it has to be very dramatic. It has to be sometimes very traumatic. And for about 85% of the births, that's not the case. It's a very normal and natural experience. So one of the things I believe that doulas and childbirth education classes have a place to do is to correct some of these misconceptions, or even some of the old wives' tales that parents or grandparents tell these prospective new parents, and try to correct the information and just give them some of the evidence-based information, the newest and most updated information, so that they can make those informed decisions.
Mm-hmm. I like that you brought up the, a lot of times TVs show negative stereotypes of a labor, and I think that creates a lot of fear and anxiety with laboring mothers. They give them a sense that, oh, well, I must need a medical intervention, or I must need help to have a normal physiologic birth because I don't want to have this type of pain. If you see negative stereotypes of labor, that's going to create fear in your mind. Then that's going to create tension, and tension causes a more uncomfortable birth. Share with the viewers how to help your clients make an educated and fully informed decision on how to avoid non-medically necessary interventions that don't support a normal physiologic birth.
Well, one of the things, I'd like to go back to the fear, tension, pain cycle just for a minute to begin this. But with the fear, tension, pain cycle, when there is a fearful experience, if a person's having any kind of discomfort, that fear will magnify the pain experience, which will cause the person to be more tense, which will magnify the fear, and you get into this vicious cycle, as Dr. Grantley Dick Reed pointed out when he first came up with the fear, tension, pain cycle. So what being a doula or being a childbirth educator can help a parent do is to break that cycle somewhere. There's actually a word for fear of childbirth, and it's called tocophobia. And what we will try to do is to help them with the fear piece and maybe break the cycle there by showing in a variety of ways, not just through videos or storytelling, but also sharing evidence, or maybe having guest speakers come in, explaining the whole process of birth, sort of tear down the walls around that fear piece so that they can see that it's not anything like they may have imagined. It's a normal bodily function that everything in this world goes through. Humans, animals, we all give birth. So we try that. And then with the pain area, we usually share with them a wide variety of what we call non-pharmacological pain relief, which is just what it says, non-pharmacy, non-medicated pain relief. So you're talking about things like nutrition and hydration during labor and birth, because a lot of times if a mom has a labor that stalls out about 5 to 6 centimeters, chances are she's not had anything to eat or drink. And just like a car, you can't make it go if it doesn't have gas. You can't have a laboring mom continue good active labor without food and fluids. Along with that, we will share with her about different comfort measures in regards to position changes. When the baby comes down through the birth canal, and this is such a miracle of birth, that the babies instinctually know the twists and the turns and the tucks that their body must take to get through the pelvic bones and out through the birth canal. And if a mom is laying flat in a bed or not moving because she's scared, the baby has a harder time making those twists and turns and tucks. But if she's up moving around, if she listens to her body, if she moves in rhythm with her body, maybe sitting on a birth ball, 20 minutes later she's sitting on the toilet, 20 minutes later she's walking in the hall. And so changing positions about every 20 or 30 minutes can really help these cardinal movements, or those twists and turns that I was talking about with the baby, help the baby to move. And it can actually shorten labor about 25%. We talk about massage, how actually not even formal massage from a massage therapist, but just touch will help to decrease the amount of perception of pain. I often liken it to what happened when you stubbed your toe the last time. Aside from saying a few words, you probably touched your toe and rubbed it. And all of a sudden the fear and the pain kind of went away from that. And then when you let go, the pain came back. And that has to do with something called the gate control theory. Your brain only has enough capacity to hold certain numbers of sensations. And because our touch fibers are so much bigger and the sensation travels faster than our pain fibers, if we are massaging at the same time as we are feeling pain, the touch is going to override the pain and reduce the perception. So we talk about that. We talk about the benefits of relaxation. We talk about breathing. It's not so much that you have to do a specific breathing pattern. It's just that you keep breathing, and breathing consistently in and out at the same level, because otherwise, if your ins and outs are not equal, you can hyperventilate. So all of these things together, along with some spirituality or meditation, guided imagery, music therapy, aromatherapy, all of these different things can bind together to make a great bag, so to speak, that the parent can take with them either to the birth center, to the hospital, or if they're having a home birth, to have at home, so that they can choose from this bag of what things they are going to use during their birth experience. And I just want to add on to that also, hydrotherapy and actually laboring in water is hugely beneficial for moms. It too can reduce the perception of pain by up to 65%. Just being into water that's covering her belly.
Yeah, as a Chinese medical practitioner, water represents yin. Have you ever seen the symbol, the yin and yang symbol?
Yeah.
Well, water represents stillness, calmness, and stuff like that. So not only for pain relief, it can really calm the mother down too.
Right.
Yeah. And then I also wanted to add to that too, an important factor in having an intimate and joyful birth is having the birth partner, if she has one, take an active role in the birth. Because I think that's a very, very important piece. And just by interviewing the experts, it's like if you're present for your laboring wife, if is supportive, making reassuring comments, and just giving her undivided attention, that's going to be amazing, because then you're both connected. It's like, with the experts that I interview, there's a common theme I see is like the energy that goes into conception is the energy that should come out during a birth. So it's like you give, hopefully when you have intercourse with your wife, you're giving your full undivided attention. And then when you have a birth, you should do the same thing, because I think that, for a laboring woman, her awareness is like 10 times the amount of a normal person. So imagine if you're giving her all your love, attention, undivided attention, that would just be amazing. That would be an awesome birth journey. If the nurse comes in the room and, how should she interact with her, and what type of questions should she ask where she's working collaboratively with her, and she has this sense like, no, I don't think that I don't feel comfortable with that decision. Like, honey, we need to give you all our patients get IVs, or you have to stay in bed, or you can't take off that electronic fetal heart rate monitor. I mean, what are really great ways for birth professionals like doulas to actually help facilitate or coordinate or collaborate with medical professionals to avoid non-medically necessary interventions that don't support a normal physiologic birth?
Well, and that goes back to informed consent again. And there are 5 major questions that anyone should ask when they're in a situation where they have to make a decision. And the first one is, how is this going to benefit me? And for the laboring mom, she can go off of that and say, well, how is that going to benefit my baby? And how will that benefit my labor? And then, and that's all assuming that there's time for that. I mean, if it's an emergency cesarean, yeah, I'm not sure you have time to chat about that. But if it's like what you were presenting, she would need to know all the benefits. Now, she may have heard about the benefits from her doula or her childbirth class, but it's always nice to hear it from the care provider that's there at the facility where she's at. The second question is, what are the risks? Is this going to do something negatively to me? Will it negatively impact the baby? And will it negatively impact the labor process? So she has to look at the benefits and the risks. The third one is, are there any alternatives? You know, is there something I can do rather than maybe have an IV? Can I drink lots of fluids? Instead of having an epidural, could I take a bath? Could I be in the tub? So there's always an alternative that, you know, can be used in that situation. She needs to explore that. Now, hopefully she will have explored some of the alternatives that they may have at the birth facility when she does a tour. But again, it's always nice to ask and be reassured during the labor process.
Okay, so Connie, I just interviewed Bridget Maher, who is the creator of the Mama Sherpas, and she mentioned in her interview that she was ashamed about the choices she made on having a planned medical induction, which ultimately led to her having a cesarean birth. She revealed that she was a busy filmmaker and made her decision to have a medical induction because of the convenience, and that her close friend had a planned medical induction and she had a smooth 3-hour birth without any complication. She now admits that if she knew about the cascading effects of her actions, she would have never have done this. What would you recommend to viewers who have, let's say, say a doula or midwife who has busy female clients who are faced with life events where relatives are in town, military husband can only be there on certain dates, or she says she's tired of having the baby and wants to go into labor on her due date? How would you, if you had a client that you had a busy female professional like that, what would that conversation sound like? How would you talk to her about that?
Well, I would go back again to the 5 questions. I would probably hand her a sheet of paper that had a B, an R, an A, an I, and an N written vertically on that paper. And the B would stand for benefits, and I'd have her either with me present or in working with her partner. What are the benefits of a certain procedure? What are the risks? What are the alternatives? The I would stand for, what does your instinct tell you? What does your gut tell you? And then the N of the BRAIN acronym would be, what if you do nothing? What if you wait? So in terms of the woman who is looking at a scheduled induction, well, what if she did wait? What would be the outcome? Well, maybe mom and dad wouldn't be there to help her out. Well, what other people in her support circle could help her out? Are there people from her church or synagogue, people from work that could put together a meal train? Maybe she would look more on having a doula, things like a postpartum doula, looking at things a little more outside the box. so that she felt very supported whatever decision she was going to make. And some women come to me and say, well, with my first birth, I did this, and I really wish I hadn't, but I didn't know. And of course, the old adage, well, hindsight's always 20/20. You make the best decisions you can at the time with the information that you have, and then you just have to let it go.
Yeah, and that's key, is education and making a fully informed consent. If you're planning a scheduled medical induction, if you're going to do that, just make sure that your Bishop score is really, like a 9 or higher, because they say that if your Bishop score is an 8 or lower and you have a planned medical induction, your risk of having a cesarean birth is around 50%. Now, if you have a planned medical induction and you have a Bishop score of 8 or higher and it looks good, your risk of having a cesarean birth is around 26%. But if you wait and go into labor naturally, your risk of having cesarean birth is around 15%. So you do the math. I think that's the take-home message, is let's just break it down really simple, and give her the options, and then tell her about the risk involved for cesarean birth, and how this, if she's planning on having more children, she might face, her hospital might have a VBAC ban, and then now she's faced with a repeat cesarean birth, and that can lead to other complications too. So,
right.
That's
and there are a lot of different ways to induce labor. There's not just take a pill and your contractions begin.
Yeah.
There are the non-pharmacological ways to induce labor, all centering around, as you mentioned, a good Bishop score. But, she can hear from her midwife or her childbirth educator or her doula, and sometimes even her physician as well, some of the more natural ways to induce labor that may not work as quickly, but will work more naturally to allow the baby to get accustomed to those first contractions. And then there's a variety of more medical ways and mechanical ways of getting labor to begin. And she should know all of those too, because some have significant side effects and some have less side effects. So to make that informed choice, she's going to need to either read or have her doula explain to her or have a childbirth educator explain to her. So you're right. Education is the key to making that informed decision.
And I want to point one thing out is that as a Chinese medical practitioner that specializes in pregnancy care, labor support, and postpartum care, I found out that if I help mothers go into labor naturally, and sometimes I have mothers that says, oh yeah, my doctor said my baby's too big and we're going to be planning a scheduled medical induction at 40 weeks. And I says, is there any other risk factors associated with that? No, just, they did they did an ultrasound. They just identified the baby was being too big. And that's not a medical reason to have a planned medical induction. And what I tell the mother is, I said, well, what's your Bishop score? Well, what's that? And then I say, well, how dilated are you? Oh, probably about a ½ centimeter. What's your effacement? Oh, about 20%. Now, if that mother came in to see me to get acupuncture to go into labor naturally, she would have prodromal labor. She would not be happy. Her doula wouldn't be happy. And so what I recommend, is I say, why don't you wait and go, wait until at least 41 plus 3. If you can go to 41 plus 3, you're going to be more labor sensitive. You're going to be more dilated. You're going to be more effaced. And so when I do the non-pharmacological approach to helping you go into labor naturally, you're only going to require one treatment, and you don't have to require as much stimulation. And that's what I found, by, working on over 300 women and, that are overdue faced with a medical induction or repeat C-section, over the last 2 years, is that's a very important piece for midwives and doulas to know. Say, yeah, you're really big on referring out for acupuncture, but don't refer out too early, because that's not a good thing either.
Right.
Yeah. So anyway, I just wanted to mention that. How can informed consent help eliminate or shorten the cascades of interventions?
Well, really important, if they know that one intervention is going to lead to another one that leads to another one, if they know that information, then they may not take that first step. And let's look at induction. If they choose to have an elective induction, maybe because of macrosomia or a baby that's too large, when did they find that out? Was that at a 40-week ultrasound? Was that at a 38-week ultrasound? Anything over 20 weeks is starting to be suspect as to the accuracy of the ultrasound. So we really can't pinpoint exactly how much the baby's going to weigh. I've seen so many of my clients say, oh, my baby is going to be 8 or 9 pounds, and so we have to have a cesarean. They have a cesarean, they have a 6 or 7 pound baby. So those ultrasounds, and the evidence shows that the ultrasounds in later pregnancy are not as reliable. So if she would have an induction in an early stage where there is insufficient oxytocin receptor sites that have been built up on the uterus, and they build up over time. They build up because of the Braxton Hicks contractions, they build up because of the stretching of the uterus, and they build up because of time. If you have insignificant amounts of the oxytocin receptor sites, if you're medically inducing this mother, the Pitocin is not going to have any place to bind onto, because whenever you have a hormonal reaction in your body, you have the hormone and you have the receptor site, so you have to have those receptor sites. Otherwise, you could pump the mom through with Pitocin until she's blue in the face, and it's really not going to do any good. That's what the definition of a failed induction is that the mom was, they tried to induce her, but it didn't work, and that was because maybe her Bishop score was too low and the oxytocin receptor sites were insufficient to receive that Pitocin.
And I'm glad you brought that up. That was a very important piece. What has been your past experience with physiologic births?
Well, most of my clients opt for that. Now, my clients right now, a very small demographic. I'm teaching privately for military couples who have very different schedules than what they might find a childbirth education class being held by, like a weekend class or an evening class, and maybe they can't do that consistently over 4 weeks or how long. So like I said, in my small demographics right now, I probably see about a 15% cesarean rate and an 85% normal physiologic natural birth.
So I wanted to point that out to the birth professionals and parents that may be watching. This interview is 85% of women have normal physiologic births, and they don't need a medical intervention to go into labor naturally. Right. That's the take-home message, is to try to avoid non-medically necessary interventions, because that can have a cascading effect, and try to find...
Right, because when you have that induction, because you're giving medication not only to the mother but to the baby, then they need to hook her up to the fetal heart monitor so they can monitor the effects of the medication on the baby. They can't see the baby, they can only monitor the baby with the tocos and picking up the contractions and seeing how that works. Well, because you have the electronic fetal monitor in place, that limits your movement. So you can't really move and do all those positions every 20 minutes that we spoke about earlier. And since you can't do that, you tend to have more pain associated with that, because you're a little bit more fearful. You have a little bit more intense pain than you would normally if you were in labor without the medication. You can't move to the cardinal movement, so you have more pain. So you might be interested then in an epidural, which will then further restrict your movement, and maybe even an instrumental birth with either the vacuum extractor or forceps delivery. So like you were saying, that cascade of interventions just keeps building on each other, and before you know it, you might be a candidate for a cesarean because the labor, maybe mom is just, she's so tired. Maybe she's been in labor for 18, 20, 28 hours, and her body's just not going to do it anymore. And so they opt for a cesarean.
Okay. So how did informed consent help you achieve the birth you desired, and how can it help others?
Well, I kind of went from a different point of view. Right after the birth of my daughter, I became a childbirth educator. So when I had our next daughter 7 years later, I had been teaching this for a while, and I wanted to know that I could practice what I preached. And so having very full informed consent, I had a wonderful natural birth.
That's awesome. So what is ICEA, and how can ICEA help parents and professionals?
Well, ICEA is, as you mentioned before, is an organization that certifies and trains childbirth educators, birth and postpartum doulas, and we have a lot of certificate programs as well. And we have as our standard evidence-based, family-centered maternity care. So we are very much advocates of, what is the most current evidence? Are you being treated by someone who's who is practicing traditionally, or who's teaching or practicing evidence-based? And that's a difference. I don't think a lot of parents realize that in a hospital setting in particular, it takes a long time for changes to be made. So maybe that practitioner he or she is still using the same things that they learned when they were in medical school maybe 15 or 20 years ago. Well, hey, a lot changes almost on a daily basis in maternity care. New research comes out all of the time. So our professionals are trained with the most updated information. On our website, we have approximately a dozen position papers that have just recently been redone on a variety of topics, including delayed cord clamping, skin to skin after the baby's born, water birth, a variety of topics, so that not only the parents but also the professionals can stand there and say, okay, this is why we believe what we do. This is why we want to have our baby on our chest right after the birth, because it's better for the baby. It helps a lot of thermal regulation, hormonal regulation. They have that evidence without having to go find it anywhere else.
Maybe a question to ask your doctor is, do you practice evidence-based medicine on having a normal physiologic birth?
Now they may say, yes, of course we do. Doesn't everybody? And then there may need to be some questions asked to follow up with that, like, how routinely do you do an episiotomy? Do you allow the cord to stop pulsating before it's clamped and cut? Are your patients likely to use a tub and do some water labor or even a water birth? So asking some of those other questions, and not only judging what they say verbally, but also looking at their body language, you can tell a lot from that.
Yeah, that's good that you mentioned that. So Connie, for the viewers that would like to learn more about the topics we discussed today, do you have any DVDs, books, upcoming classes, webinars, conferences, or trainings you'd like to mention?
Well, on the ICEA website, we have workshops constantly going in a variety of locations around the world. As I mentioned, we do have the position papers. We have our joint conference with Lamaze International this year, as you mentioned, in Las Vegas. If they're interested, if they're doulas or childbirth educators that are interested in attending, you can go to Lamaze ICEA 2015.org and register for the conference. As far as me personally, I also have a website called birthsource.com, and there has a lot of information for both parents and professionals, written information. And then later this year, I do have 2 books coming out for professionals. One is called Creating and Marketing Your Childbirth-Related Business, and the second one is called Innovative Teaching Strategies Handbook for the Birth Professional, and both of those are being published by Proclarius Press.
Very cool. So Connie, thank you for chatting with me today and also sharing your insights with us.
Thank you, Nick.
You're welcome.